Hi, my name is Charity Rice. I'm the orthopedic coordinator here at Menorah Medical Center. This portion is the daily activities teaching of the joint replacement class. This is my contact information. You can call me with any questions or concerns that you may have. What to expect the day of surgery is post-op day 0. Our goal is to have you up and out of bed the same day of surgery. We want you to attempt to walk at least 5 feet, either with physical therapy or nursing. We will begin your post-op exercises with the physical therapist, and you'll learn any joint precautions that you may have. Post-op day 1, the day after surgery, you'll work with physical therapy usually in the morning. Their goal is to have you walking at least 50 feet the first session, 100 feet the second session. We'll practice stairs if this will be your day of discharge. And we will help you to understand and verbalize any joint precautions that you may have. Occupational therapy will see you in the morning to help you get dressed and do any personal grooming that you may want to do. You'll also work with your nurse to understand your pain management routine and any type of blood thinner medications that you'll be on. This may be the day of discharge for some. Post-op day 2, we want you up in the chair for most of the day. You'll work with physical therapy again, walking in the halls, practicing stairs, and reviewing any joint precautions. Occupational therapy may be able to help you get into the shower and get dressed in your own personal clothes. You'll continue to work with your nurse to understand what type of pain medication you're on and what your blood thinners are. Usually by this day we know where you'll be going after at discharge, whether it be with home health or transfer to a skilled nursing facility or rehab, or you may be going to outpatient therapy. The goals for discharge, we want you walking at least 100 to 150 feet safely with your walker, being able to get in and out of bed on your own while you're supervised by staff. We want you to be able to go up and down safely with the stairs with a walker. For our knees, we want you to be able to bend at least 90 degrees and get your legs straight to 0 degrees. We'll also make sure that you're medically stable. Most of you will have a hospitalist that will see you while you're here, and they'll be checking on your medical stability. If you're going home, make sure you have somebody there with you for the first 24 to 48 hours. Please ensure that you attend your first follow-up appointment. Most of our doctors would like to see you back within about 2 weeks. You're going to follow your discharge guidelines that have been given to you when you leave the hospital. And we want you to remain active and tolerated and continue your exercises as instructed by your physical therapist. Again, my name is Charity Rice, and these are my contact information. You can call me with any questions or concerns. Thank you.